Hi, today my presentation is on stem cell treatment, presented by myself, Thea Benoit. Let's get started and I hope you enjoy. Here are some background information on stem cell treatment. Stem cells are special cells with two important abilities. They can reproduce themselves with self-renewal and can develop into multiple other cell types that undergo differentiation. These cells provide purpose in almost every tissue in the body, and they play a crucial role in tissue maintenance after injury. The type of tissue stem cells can transform into is determined by the location. Hematopoietic stem cells in bone marrow generate all types of blood cells, and other stem cells can then convert to nerve cells, bone cells, and heart muscle cells. But not all stem cells are similar. Embryonic stem cells are the most adjustable, and they can grow into any type of cell while developing a baby. Other cells in the human body aren't as proficient and are mostly involved in storing tissues that are healthy and fixing deterioration where they stay. Here is some interest on stem cell treatment. Stem cells can function as beneficial models for analyzing the safety and efficiency of exploratory drugs. Prior to human studies, examiners used these cells to screen for prospective toxic effects, including cardiotoxicity, resulting in improved early-stage drug assessment. Learning about how stem cells evolve into heart, bone, and nerve cells and different tissue types can serve researchers to obtain a deeper perception of how diseases and medical conditions format. On to the next slide of the subtopic on stem cell treatment. Different types of stem cells used in treatments. Embryonic stem cells are sourced from embryos that are 3 to 5 days old. The embryo is in a phase called blastocyst, and they can store around 150 cells. Adult stem cells is a group of cells identified by places like bone marrow or fat in adults. These can support the repairing in the body but cannot convert into many different cell types as embryonic stem cells can. Stem cell therapy and regenerative medicine. Stem cell therapy supports the body to repair itself by using stem cells to rebuild the tissue that have damage, not working as they should, or have diseases. This is a promising alternative to traditional organ transplants. Specialized cells can be implanted into a patient because if the person is suffering from heart disease, for example, these cells can be put directly into the heart muscle. The transplantation then plays the role of healing the damaged heart muscle. Here are some scientific advancement. Stem cell transplantation, often referred to as bone marrow transplantation, has been a beneficial therapeutic procedure for decades. Hematopoietic stem cell transplants include the replacement of cells that can be ruined by chemotherapy or diseases that can facilitate immune-mediated targeting of certain hematologic malignancies. HSCT was first successful in 1956 with bone marrow from an identical twin for a patient living with acute leukemia. Radiation did not help cure the patient's leukemia. The donor's marrow replaced the patient's marrow. 50 years later, HSCT remains the main stem cell therapy in clinical use. Here are some beneficial global impact. As stem cell treatments move from the lab into common medical care, it could help make healthcare easier to access. Some diseases that used to require expensive long-term treatment might be treated more simply and at a lower cost nowadays. This supports patients as well as reduces pressure on the healthcare systems because scientists worldwide are working as a group on stem cell research. Sharing what is learned can help improve healthcare in countries that don't have many resources. Stem cell research isn't about money. It also has a huge effect on a community. It can bring hope and joy to people with diseases that don't have a cure cure yet, and it can improve their lives. It raises crucial questions about fairness in healthcare. For example, what's right, what's wrong, and what can we teach and learn about stem cell treatment? Now, here are some detrimental global impacts. The risks of stem cell treatment depend on multiple things. A risk means how likely it is that something harmful will happen and how serious it would be. Some important factors that could affect the risks include the kind of stem cells that are used, how they are collected and grown, and where they are put in the body. Doctors and scientists have to look at both known risks from clinical experiences and possible risks when deciding if the treatment is effective and safe. Some stem cells can lead to tumors, and this happens in some cases. Therefore, it is a concern that must be taken seriously. Here is my reference list from all the information that I have collected for this presentation. Thank you for listening. I learned a lot while making this presentation and doing the research on stem cell treatment, and I will continue to do research on it because it is very insightful, and how something that I'm not usually into, which is being in the medical field, could save somebody's life when they have heart disease, cancer, any type of disease or injury within the body. So I hope you enjoyed. Thank you so much for listening.